Hello there. My name is Dr. O, and welcome to the Ozone Medical Center. I see you have a referral from your old doctor. May I see it? Thank you. I'll just have a flick through. Why don't you go ahead and have a seat and get settled in while I read this? Yeah. Okay. Oh, I see. This is from Dr. Blake. Yeah. Him and I used to be friends. We went to university together. So that must mean you're new in town. Is that right? I see. Well, welcome to the area. Glad to have you with us. Thank you for making your online appointment. Were there any sort of tasks or activities or jobs that you needed to be cleared for specifically today? No? Yep, so just after a regular doctor appointment, checkup, that type of thing. Yeah, no worries, we can definitely do that. I know you did do our online questionnaire, however, there was just a few nitty-gritty details we had to work out before. Yeah, they're all yes or no questions, so we'll get through them quite quickly. So, first of all, do you have any thyroid problems? No? Okay. Any heart conditions such as high blood pressure? Okay. Rheumatoid arthritis? Asthma or any other respiratory conditions such as chronic obstructive pulmonary disease? No? Okay. Yep. Good. Any diabetes, type 1 or type 2? No? Yep. Skin conditions such as eczema? No? Any open wounds or fractures I should know about on anywhere in your body? Okay. Yep. No, that's good. Any double vision or dizziness, vomiting, nausea, any of those type of symptoms? No. Okay, that is good. And lastly, any signs of inflammation or infection that you're aware of? No. Okay. Well, I'll sign off on that. That is all good and updated in your chart. And you definitely haven't experienced any of those in the last 48 hours. No. Okay, just making sure. You can never be too careful. Well, let's get straight into it. We'll start by taking a blood pressure reading. We have our little blood pressure cuff here. This one's just going to go around your bicep region in your lower arm, or your upper arm rather. Just going to tell us and give us information about your systolic and diastolic blood pressure. Yeah, okay. Shouldn't be any dramas, like you said, you don't have any high blood pressure at all. So we'll just pop this cuff around your arm. That's it. Yep, if you could just rest it on the bench that's right there. Yeah, thank you. Excellent. Okay, so that one's all over you. Let's just work this one now. It is automatic, so it'll just work its little magic there. Let's go. Yep, just try to let your arm go loose while it does its job. Okay. That is all done. So our systolic came back as 124 and our diastolic as 84. And those are all normal parameters, so that's good. We were expecting that anyway though, so excellent. One thing, however, our pulse or heart rate monitor for it did not work. So I'm just going to take a manual reading. Yeah, not invasive at all. Very easy to do. Yeah, I generally like to do the carotid area here, but for today, since you're sitting down already, I just want to do your radial pulse right next to your thumb side of your wrist. Yeah, okay, if you could just rest that one out for me. I'll just get a reading there with my watch. Just count that one in. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, 20 beats in 15 seconds. Bit of quick arithmetic, and we arrive at around about 80 beats per minute, which is still within normal parameters. That is fine. What's that? It's normally a bit lower than that. Yeah, okay, yeah, that's all right. Sometimes when we walk in the doctor's office, we can tend to have a bit of a spike because of the anxiousness and nervousness, yeah. But that's okay, I'm sure it'll be down by the end of the session. Yeah, okay, so still within normal limits. Yeah, I'll just put this one off to the side. Now, Okay, I'm sure you're familiar with these. Doctor's bread and butter, our stethoscope. If you could please sit up nice and tall there. Yep, you've got good posture, by the way. I'm just going to be listening to certain areas on the front and back of your chest. Yeah, so listening for breath sounds, essentially. Auscultation is the fancy word. But, okay, if you could take a nice deep breath in through your mouth and exhale out through the mouth, that would ensure that we get the best quality sounds. Yeah, okay, so just breathe in and out. That's good. Get nice and close there. Good. That's fine. Okay. Good. Okay. So we're a little bit shallow with our breath sounds on the basal part or bottom section of our lungs. What I'll get you to try do next actually is just to have your hands, place them firmly over your diaphragm and the bottom part of your rib cage there. Yep. Now I want you to do a little exercise. We're going to practice taking a nice deep breath in through the mouth. We're trying to expand our lungs so that our hands move out a little bit. Yep. Exactly like that. Yeah, we're trying to get the air deep into the bottom parts of our lungs. Excellent. So that's looking a lot better. Keep doing that type of breathing. I'll just have another listen on the basal parts of your lungs. Okay. Go again for me. Okay. And just the other side. Okay. Excellent, that's come back a lot better. Yeah, we can hear those parts of your lungs now. No crackles or any abnormalities as well, which is always a positive sign. Next, I would like to check your tendon reflexes. So I'm sure you've seen the doctors sort of smacking the knee to check the knee jerk. Yes, this is not a trick or a stunt at all by any chance. We're not just having fun. This is a test for our deep tendon reflexes. They're quite important. Yeah, it can let us know whether the reflexes are hyper-reflexive or hypo, that is, they're more sensitive or less sensitive. They can help us detect any upper or lower motor neuron lesions. One example, I remember a few years ago, the Ice Bucket Challenge. If you do, that's good. That was actually to promote information or promote awareness of ALS, which is amyotrophic lateral sclerosis, and this is actually something that Stephen Hawking had. So something that is just a bit of an example, yeah, to give it a bit of relevance to you. Yeah, I know, right? So just going to be lightly tapping on your triceps tendon, your patella tendon below your kneecap, as well as your Achilles tendon. Yes, so just lightly. This isn't a painful process by any means. Please try to remain calm throughout this. Yeah, okay, so here we go. Good. Okay, let's move on to your patella tendon now. If you could just have your knee sitting nicely there. Good reflex on the other side. Okay, now lastly your Achilles. We'll just test your left leg first. Excellent. And then your right. Okay, excellent. So all of those reflexes came back with no abnormalities, so thumbs up there. Definitely no signs of any upper or motor neuron lesions there. The other thing we're going to check is your ocular muscles or a couple reflexes. The first one being our vestibulo-ocular reflex in our eye. So what that essentially does is help fixate our gaze while our head is moving horizontally, vertically, as well as diagonally. So what I'll ask you to do is to fixate your gaze on the tip of this pen and rotate your head to the left, to the right, up and down. Yeah, okay. Just having a look at your eyes while you do this. That's it. Go to the left and then the right. Good. Good. Alright, so that's looking pretty good. Now up and down. Perfect. Okay, sorry, just getting close there to check your eyes for any nystagmus or shaking of the eyes. Good. Up and down one more time for me. Okay, perfect. Okay, that is all good there. We're not done with the pen yet, however. We're going to test what's called our saccadic rhythm next. So saccadic rhythm is essentially the fancy word for being able to rapidly move and accurately move our eyesight in response to different stimuli. So very important when we're driving, which is why it's part of our test today. When we're driving, we need to be able to see the hazards on the road, of course, quickly. So essentially we test this by looking at the tip of the pen, and then I'll get you to follow it while I move it rapidly around your field of view. Okay, so starting here, 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 up twice, top nice and high, there. Good, 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 excellent. And lastly, well done. Yeah, so no dramas there. You don't feel dizzy or anything? Excellent. Okay, please let me know rather if you do feel dizzy. Yeah, excellent. Okay, so not done just yet with these ones. Our last test for your eyes is what's called smooth pursuit. Yes, so smooth pursuit. Yeah, essentially we're going to follow this pen with your eyes in a smooth action. Yeah, so just keeping your head still, following this pen with your eyes. Good. So horizontal is fine, and let's go vertical. Good. Very good. Excellent there. That is all clear. So no dramas with those tests. Excellent. The other thing we're going to try now, I'll just get my gloves on. We're going to look onto your face. I just want to test some sensations, so bear with me. This is a tricky process getting these gloves on. Okay. It might be one size too small, but we'll just have one glove in the meantime, and I'm just going to be feeling on various parts of your face, testing your sensation. Yeah. So first off, can you feel this? Can you feel this? Okay. Now that's the easy part. That was with our eyes open. Let's have our eyes closed. Now, can you feel this? Can you feel this? Good. And does this feel the same as this? And does this feel the same as this? Good. Okay, so that is excellent. That is testing for our dorsal column or our medial lemniscal pathway, which is an afferent sensory pathway that sends information to the brain and lets us know details such as fine touch, among others, which we will test later. But that is all clear, our dorsal column on our face at least. So and our facial nerves rather. So let us check another tract. This is our spinothalamic tract, which is responsible for transmitting sensory signals to the brain for things such as temperature and pain. So we're going to test that with these hot and cold glasses of water now. I know you can't see them, but I want you to feel them. That's it. You can tell that's a hot one and that's a cold one. Perfect. Okay, now closing your eyes, I'm just going to place them on your back, various parts of your back. Let me know if they're a hot or a cold sensation. Yeah, okay, let's go testing the spinothalamic tract once again. So if I place that there, hot, excellent. And then this one, hot, yep. Cold, good. Over here now. Hot, yeah, bit of a trickier one, that one. And now down here. Cold, excellent. Okay, well, all those sensation tests tests rather, are fine. No issues with our sensation. So I'll just get these gloves off. Actually, while we're at it, while I have the gloves on, let's do a little bit of a prod and poke into your mouth or your oral cavity for any signs of infection or inflammation. So do you mind for me opening out your mouth nice and wide like a lion? Good. Good. Excellent. Don't worry if you have bad breath or anything. I lost my hearing years ago. Yeah, I've been doing this for a while. So let's have a look. Just checking in your posterior throat or your back end of your throat. Looking like a uvula is all clear of any mucus buildup. Excellent. Okay, you can go ahead and close your mouth there. That is good. No signs of infection in that area of your mouth, which is always good. You don't feel any sore throat or... Yeah, so no sore throat and no fever. Perfect. Yeah. Excellent. By the way, I'm no dentist, but your teeth are pretty spot on, so keep doing what you're doing in that regard. But let me just have a flick through my notes. We shall be doing a few more tests. Yeah, we're quite extensive here. We want to make sure we cover all bases. But next, we're actually going to be performing testing out what's called our proprioception. So our proprioception goes back to our medial lemniscal pathway, or our dorsal column, as I mentioned earlier. What this will do is determines your body's position in space. So essentially, if I close my eyes and have my hand right here, I know that it is right next to my face. I am aware of where my body is in space without the use of my eyesight. Yeah. So that's what our proprioception is. Yeah. So let's test that with you. One way we test that is through joint position testing. So basically, I'm going to be moving your wrist either up or down. Yep. So this movement is up and this movement is down. I want you to have your eyes closed. I'm going to do the movement for you, and I want you to let me know whether it's up or down. That's it. Okay. So, yep. Just holding your arm there. Good. That's up. That's also up. Good. There was no change there. Yeah, that's good. Trick question. Down. Up. Down. Okay, perfect. Let's try that with your shoulder now. So essentially, this will be up and this will be down. I can't really do it, my shirt's tucked in, but you get the idea. Excellent. I'm glad it makes sense. Let's see how we go now. So closing your eyes, I'll do the movement for you. Okay, so up and down, up, down, down. Okay, and relaxing your arms and opening your eyes. Perfect. Okay, that is also looking good. Now I just have some coordination testing. So if you could please try and touch your nose and then my finger. Yeah, just testing for any cerebellar lesions or cerebellar issues, which is an important thing for our coordination and everyday tasks, including walking, running, typing, those types of things. So let's see how you go, touching your nose and then my finger. Yep, so your nose, my finger, your nose, my finger, back to you, back to me, back to you, back to me, back to you, back to me. Okay, so that is all good there. No signs of overshooting at all. So very accurate. Another one we're going to do is what's called opposition of the thumb. Essentially, I want you to be able to touch each finger with your thumb in this order as fast as you can without sacrificing accuracy. Yeah, so try that with your right hand, or is that your dominant hand? Yeah, try that with your dominant hand first for me. So, yeah, just like this. Good. And then try it with your other hand for me. Yeah, that's good. Very slight mistakes there, but you can do it. Excellent. Now, our last little coordination test is something for what's called dysdiadochokinesia, and that is not a lie. That is a fancy Latin word, dysdiadochokinesia, which essentially means can you perform rapid alternating movements. So essentially, I'll get you to have your hands in your lap and then rapidly alternate between your palm up and your palm down. Okay, now if you could please demonstrate that for me. Okay, that's looking fantastic there. We definitely do not have dysdiadochokinesia. Say that 5 times fast. Okay, well, let me just check my notes once again. I think we've pretty much covered all bases. Excellent. Well, that actually concludes our medical examination today. So, as I'm sure you already know, your results are all fine. No issues, no abnormalities, nothing of concern, essentially. So you can breathe easy. In fact, I think between you and me, a couple of doctors could take a page out of your lifestyle and maybe make some changes themselves. So you didn't hear it from me, though. I'm just kidding. You are doing excellently. So I hope that provides a bit of reassurance to you, and I recommend a checkup in, what's today, the May? Okay, I recommend a checkup around about January or December this year, maybe. So about 6 months' time, give or take, just to make sure that everything is tracking along nicely, as they are. So if you enjoyed this, I would highly appreciate it if you left a like on this one, as well as clicked the subscribe button if you would like to see more of this content. Enjoy the rest of your day.